What's up, YouTube? It's Iman coming to you with a quick weight loss surgery update, pregnancy update. So, I don't have a whole lot to say, but it's been a month since I checked in, and so I wanted to just come in and make a video. Sorry I'm not standing, showing off my belly. I will try to incorporate a picture in here for you. It has been a long time. It's September. It's been a little bit more than 10 months since I had my surgery, and I got pregnant approximately 3 months post-op. So I am 8 weeks away from delivery, and so far I am up 13 pounds from my lowest weight. I've well, not from my lowest, I actually lost weight in the first trimester, but I'm up 13 pounds from when I found out I was pregnant, or when I got pregnant. So I was really hoping to only gain 15 pounds, because my doctor's goal is 15 to 20 pounds, and at 13 pounds and 8 weeks to go, looks more like I will be surpassing the 15-pound goal. But I think I can manage to keep it under a 20-pound gain. I don't know what to talk about. My current weight is 225. My current weight is 225. So I got down to sometimes it's 224. But I'm just going to wait. No, that's not right. Yeah, I guess it is right. About 224, 225. That's about 12-pound gain. 224 is a 12-pound gain. I'm sorry. I had to think about that. Yeah, 224 is a 12-pound gain. So, yeah, that's my current weight, 224 pounds. Trying to keep it under 227, but we'll see. I'm sorry. I don't know what to talk about. I just wanted to check in because I hadn't checked in a while. So I'm currently today 32 weeks, and I am having a baby girl. I'm sure that I have mentioned that. I go to the doctor tomorrow. I should have wrote some notes. I don't know what you guys want to know, but I know this. I've said it before that I wanted other women who got pregnant sooner than they planned to after weight loss surgery to be able to refer to my video. My journey. As you can see, I'm slowly starting to put on a little weight in my face. When I look at pictures from my son, I put on so much weight in my face. I'm going to attach pictures, and I hope they come out right, because I noticed that sometimes when you attach pictures, the movie maker, like, zooms in or out, and it doesn't really focus on what you want it to focus on. So I'm going to attempt to post. I just took maternity pictures at 31 weeks and some days. And with my son, I think I was about 30 weeks. I was in between with my son's pregnancy, with my pregnancy with my son and my pregnancy with my daughter. I was between 30 and 32 weeks in the maternity pictures. So I did a side by side that I'm gonna post for you guys because I just can't believe the difference. It's about a 70-pound difference, and I had gained with my son by the end of pregnancy about 65 pounds, I think. And so for me to be 8 weeks from delivery and only up 13 pounds, 13 pounds, 12, 13 pounds, whatever it is, you guys. That's pretty awesome. And I really do believe I'll be able to stay under 20 pounds, even though I was trying to stay at 15. 15. But I mean, the baby's getting big. She's putting on half a pound a week. So the weight really isn't me at this point. If I gain more than half a pound in a week, then some of that weight is mine. But, for the most part, it's her. She's getting bigger, getting ready to come join us. So, I mean, I don't have any weight loss surgery related issues with my pregnancy. My doctor is considering me high risk. I believe I said that because I am still technically obese, even though I'm much smaller than I was 4 years ago. And because I had this surgery, the possibility, the way my body absorbs vitamins is not necessarily could be a problem. So I'm high risk because of that. I'm high risk because my blood pressure elevated with my son, and before we could confirm preeclampsia or eclampsia, I had my son. So my doctor is treating me as if that a preeclampsia is a possibility. And she says that even though we didn't get the test results back to confirm, because I had the baby, like as soon as I turned in the urine collection, I had the baby that day or less than 24 hours later. So I'm sure my medical records have confirmed it, but 4 years ago they were paper, and those medical records are in storage now, and they're not on the computer. So she's just treating me like I had as if the test confirmed preeclampsia, and so that's fine. I mean, I'm not taking any medicines or anything. She's just keeping a close eye on me. My blood pressure was great until that 48 hours before I had my son. And at that point, I was going to the doctor every week. So the week before, I did not have elevated blood pressure. I don't know if my blood pressure elevated the next day or what, but I did not have elevated blood pressure the week before. I came in and it was elevated. And so she's like, I'm seeing a specialist for my ultrasounds to keep an eye on the baby because with Zachariah, my placenta just started to detach. Not detach. What's the word that she used? My placenta started to break down, basically. And so it really, I really got, lucky the way I went in to get checked out. There was, what my concern was actually not a concern at all. But they did notice my son's heart rate dropping and stuff like that, so they kept me, and I had my baby in 24 hours, and that's in about 24 hours after I went into L&D. So I'm seeing the MFM, maternal fetal medicine doctor, for ultrasounds, just to keep a close eye on the baby and the placenta, my uterus. Make sure that, you know, making sure that we don't see any patterns that were, things that developed with Zachariah. And so far, so good. I go to see her on the 22nd. Hopefully